I'm going to be talking in this PowerPoint about the development of the face and neck. The first step in facial development is the oral pharyngeal or buccal pharyngeal membrane disintegrates. When that oral pharyngeal membrane disintegrates, remember I told you it's kind of like at the back of the throat, the stomodeum, which is the primitive mouth, enlarges in depth and width. Facial development starts in week 4, ends in week 12. There are 5 processes that develop from 3 centers for growth. So to make the upper face, we have 1 frontal nasal process coming over from the top. Remember the picture of the guy that has the 3 different shades of purple in your histology book? That's what I want you to think of. So the frontal nasal process is that light purple that comes over the top and makes up the center of the face. Then we have 2 maxillary processes that make up the mid-face. Remember, those maxillary processes are formed from the mandibular arch. Our lower face is made up of 2 mandibular processes. So that's 5 processes, 3 centers for growth. Facial development begins during the 4th week and all 3 embryonic layers are involved. So we've got ectoderm, mesoderm, and endoderm. It begins with the formation of the stomodeum or the primitive mouth. The oral pharyngeal membrane disintegrates, the stomodeum enlarges in depth and across the surface of the midface. Now there's access between the primitive pharynx and the stomodeum. In general, overall growth of the face is going to be inferior and anterior in relation to the cranial base. The upper face is going to grow most rapidly to keep up with the brain. The forehead, here's a fun fact, the forehead ceases to grow after 12, but the lower 2/3 of the face later grows until 3rd molar time, which is between 17 and 21. The development of the face starts at week 4 and ends at week 12, with oral structures developing at the same time. The oral pharyngeal membrane, or the buccal pharyngeal membrane, remember hygiene has 2 words for everything. When that disintegrates, there is ectoderm on the outside, or the stomodeum side. Then there's endoderm on the inside, or the respiratory lining, digestive tract lining area. The oral pharyngeal membrane and that opening, so it's like the back of your throat, separates the stomodeum or the primitive mouth from the primitive pharynx or gut. It disintegrates at the end of 4 weeks. In this picture, you can see the developing brain, the primitive pharynx and foregut. You can see the stomodeum. The line in between those is where the oral pharyngeal membrane is going to rupture, and then the endoderm is going to be lining the primitive pharynx and foregut, and the ectoderm is going to be lining the stomodeum. The stomodeum will give rise to the oral cavity, which will be lined with oral epithelium derived from ectoderm as a result of the embryonic folding that we're starting to see in this picture, but we'll see in the future. Oral epithelium and associated underlying mesodermal tissue will give rise to the teeth and different associated tissues in the oral cavity. Rathke's pouch is formed from an invagination of stomodeal ectoderm. It originates from the stomodeum. There's a small invagination of stomodeal ectoderm. That pouch deepens towards the developing brain, and cells differentiate and develop into the anterior pituitary gland. The posterior lobe of the pituitary develops directly from the brain. So remember, Rathke's pouch and anterior pituitary gland. I almost think of this one like, remember foramen cecum and thyroid? Rathke's pouch goes with anterior pituitary gland, and then posterior pituitary gland is directly formed from the brain tissues. The first step in facial development is the disintegration of the oral pharyngeal membrane. The second step is the lower face development. So below the stomodeum, and remember I said think about it just this open hole at the back of the mouth, in the throat area. Below the stomodeum that's going to start to grow anteriorly and inferiorly, there are 6 branchial arches or pharyngeal arches. These branchial arches depend on neural crest cells for everything to develop correctly, just like all of the head and neck and most of the teeth structures. Branchial arch 1 specifically is what's going to grow medially, and it is going to give us the mandibular processes. The mandibular processes, one on each side, coming from the branchial arch. Remember I said that branchial arch, think about it like a neck roll. And the mandibular processes are going to start forming and fuse at the midline where the mandibular symphysis would be to form the mandibular arch. Two bulges appear inferior to the stomadeum, two mandibular processes with core of mesenchyme formed in part by neural crest cells that migrated to the facial region to join mesoderm. They fuse at the midline to form the mandibular arch. It's also considered, the branchial, it comes from the branchial arch. During growth, mecal cartilage will form within that arch, which later disintegrates as the mandible ossifies and hardens. This is a picture of the embryo at the 4th week of development. You can see the developing brain area in the frontal process, which is larger to cover that developing brain. You can see the sensory organs are starting to develop in the places where the play codes are. So the nasal play codes are there for the nostril area, the nose area. The lens play codes for the eyes. The future ears already are seen with the otic play codes. We have the developing heart. The heart will begin to beat by 4 weeks, and we will hear it clinically by 8 weeks. We can see the stomadeum is starting to take shape. We've got the branchial arch that is going to give rise to the mandibular processes, which are going to join in the middle to form the mandible. This picture shows the facial fusion, so the type of fusion that eliminates a groove or a furrow between two adjacent swellings on the same type of tissue or the same surface of the tissue. When we look at the palate, and you guys will see in the next video, that the palatal fusion is two separate structures from two different surfaces. So we've got the primary palate coming from the frontal nasal process, and we've got the palatal shelves, the lateral palatal shelves that are coming from the maxillary processes. So two different surfaces versus, so they're going to have to actually fuse together, where this is facial fusion within the same type of tissue. Facial development depends on the 5 major facial processes forming starting with the 4th week. The first part of the face to form after the stomadeum is the lower face, and that mandibular arch comes from branchial arch 1. We've got 2 mandibular processes that come together at the symphysis to give us the mandibular arch. That will also give rise to, basically the lower face. So think of our guy in that darkest purple down at the lower face area, but that also includes the lower lip and all of the mandibular teeth and associated tissues. Those are all forming from within that lower face development from the mandibular processes. This is the picture of the face that I keep referring to. In the last slide, I believe I said purple for the bottom, but you can see obviously that it's blue. I know we've had arguments over the blue, purple, what's blue and purple, but the bluer one towards the bottom is the mandibular processes. They're going to come together in the middle at the symphysis, and then we've got the maxillary processes that bud off of the mandibular process, and they meet with the medial nasal processes to form the upper lip. The medial nasal processes in the middle, where the philtrum is, come from that frontal process, which is our light purple in the middle. And those are the 5 processes that come together to form the face. Upper face development starts with the frontal nasal process developing during the 4th week above the stomadeum. Remember I said that the mandibular process is moving out anteriorly, and then we've got the frontal nasal process coming up and over. That will give rise to the upper face, including the forehead, the bridge of nose, the primary palate, and the nasal septum. There are play codes that are in place in the upper face development. We have the lens play codes on each side of the frontal nasal process that will give us the eyes. The otic play codes will form the future ear, and the nasal play codes, which are just above the stomadeum, will contribute to nasal development. Those are our sensory play codes for our sensory organs. At 4 weeks, the disintegration of the oral pharyngeal membrane enlarges the stomadeum and allows access between the primitive mouth and the pharynx. The frontal process enlarges, helping to form the nasal region. The mandibular process gives rise to the maxillary process, then fuses together at the mandibular symphysis, forming the mandibular arch inferior to the enlarged stomadeum. You can see in this last picture that the maxillary process bulges have started to form and are going towards the center. They're going to meet kind of at that labial commissure area. So you can see even in just the short time period, there's a lot of morphogenesis happening. During the 4th week, tissue around the nasal placodes grows. Nasal pits will form and become the nasal cavities. The middle portion of tissue around the nasal placodes will become crescent-shaped, and that will be our medial nasal processes, and that will fuse to form the center of the nose and the center of the upper lip. Those will actually meet with the maxillary processes to form that upper lip. If there's a failure of fusion between the medial nasal processes and the maxillary processes, then that could result in a cleft lip. This picture shows the blue crescent-shaped medial nasal processes that are going and meeting together in the middle, fusing with the maxillary process to become that upper lip. That medial nasal process is going to further kind of tuck in to become the intermaxillary segment, which will lead to our primary palate, which is in our next PowerPoint. The paired and fused medial nasal processes grow inward at their inferior or bottom border to form the intermaxillary segment, which will eventually become the primary palate, premaxilla, anterior palate, the anterior 1/3 of the palate. On the lateral side of the olfactory pits are 2 other crescent-shaped swellings called lateral nasal processes. That's going to give rise to the sides of the nose. The fusion of the lateral nasal processes, the medial nasal processes, and the maxillary processes gives us the nostrils. The medial nasal process, when that fuses to give us the upper lip meeting with the maxillary processes, it will also continue to move inward to give us the nasal septum area. This picture shows the blue medial nasal processes that are fusing to form the upper lip and meeting with the maxillary processes on the sides to form the upper lip. And it also shows us the purple lateral nasal processes that will make up the side of the nose. The picture on the right shows us the intermaxillary segment with the developing nasal cavity above and the upper lip and lower lip, our primitive pharynx and primitive mouth, the stomadeum starting to enlarge. Now, I've already been talking a little bit about the maxillary processes and how the maxillary processes come from the mandibular process that came from branchial arch 1. Remember, knowing it backwards and forwards is important. During the 4th week, the mandibular process buds. Those buds grow upward and medially, and they become the maxillary processes. They will form the midface, so that purple color in the middle will form the midface, including the sides of the upper lip, cheeks, posterior palate, the maxillary canines, and posterior teeth. When we talk about the palate, there are 2 lateral palatal shelves that come from the maxillary processes. They come in a vertical direction. When the tongue finishes forming at 8 weeks, then they flip up to the horizontal position to become the posterior 2/3 of our palate, or our secondary palate. But those all come from the maxillary process, which budded from the mandibular process, which came from first branchial arch. During the 4th week, maxillary processes fuse with the medial nasal processes to form the upper lip. That is complete by 6 weeks. The maxillary processes on each side partially fuse with the mandibular process to form the labial commissures. Clefts can occur whenever processes fail to fuse. So clefts can be partial or complete. They can involve soft tissue, hard tissue, or both. There are clefts and furrows that are located between swellings as they go through proliferation, differentiation, and morphogenesis. They are usually eliminated as underlying mesenchyme fills the furrows. So think even about dimples. You know, how cute are dimples? But dimples are actually places where there is a little bit of a furrow that didn't get quite filled in as much as it needed to be with mesenchyme. If we have a failure of fusion of the maxillary process to fuse with the median nasal process, we can have a unilateral one side or bilateral two side cleft lip. The most common cleft lip is a left side unilateral cleft lip. Most of the time the cleft's to the left. 1 in every 700 in the Caucasian population, 1 in 2,000 in the Black population, 3 in 2,000 in the Hispanic population. White males are 2 times as likely to get cleft lips or cleft lips and palates. More white females have cleft palate only. Here's an example of a left side unilateral cleft lip where there was failure of fusion of the median nasal process and the maxillary process to fuse together properly. Again, keep this picture in mind because that blue shows our mandibular process area. Our purple shows the maxillary process coming and meeting with the frontal nasal process that forms our mid-face. It shows you what areas are formed from those different colored areas. The maxillary processes, remember, form the secondary palate by having the vertical shelves that flip up to the horizontal to become horizontal shelves once the tongue moves out of the way at 8 weeks. Also forms the canines and the posterior maxillary teeth. The frontal nasal process, which further goes through the nasal area down into the medial nasal processes. They fuse, they form the intermaxillary segment, which becomes the primary palate. That will give rise to the maxillary incisor teeth. So maxillary incisors come from only the central and laterals, so 7 through 10 come from the light purple area. The dark purple area where the maxillary processes gives us the canines and the maxillary posterior teeth. And then the blue area for the mandibular processes gives us all the mandibular teeth. And with branchial arches, we have branchial grooves and then pharyngeal pouches, which are behind the branchial arches and kind of follow the grooves backwards. I told you to think of the branchial arches like neck rolls. So we've got 6 neck rolls, and then we've got grooves in between those neck rolls. And if we stuck our hand into those grooves, we would be able to feel in the pouches. Now, specifically, the first branchial arch forms the mandibular arch. So kind of mandibular arch comes from the first branchial arch, so the first neck roll. The second branchial arch forms the hyoid arch. Then the third forms parts of the hyoid bone, the pharyngeal muscle, and the mesoderm of the third arch. The fourth and sixth branchial arches fuse and participate in laryngeal cartilage formation, mesoderm of these arches, associated muscles of the pharynx and larynx. The fifth branchial arch is often missing or included with the fourth, and then the sixth, of course, I just told you, fuses and participates to form laryngeal cartilage. So the first one's mandible, second one's hyoid, third one's parts of the hyoid, fourth and sixth are more the laryngeal cartilage, so it kind of goes down the neck. The branchial grooves are between the arches. Only the first groove contributes to the eardrum and the tympanic membrane. The rest of them we don't need to worry about what they contribute to. The pharyngeal pouches that come next, the first pouch contributes to the auditory tubes, so again, ear structures. The second pouch, the palatine tonsils. The third and fourth pouches, the parathyroid and thyroid, come from the pouch lining, and part of the thymus, which has ectodermal origin. The branchial arches are U-shaped bars below the stomodeum. Core of mesoderm formed by migrating neural crest cells. They're covered externally by ectoderm and lined with endoderm. Branchial arches 1, 2, 3, and 4 are involved in base and oral cavity development. We will find that 1, of course, is lower face development. 1 is also has to do with the body of the tongue. 2 and 3 more with the base of the tongue, and then 4 with the epiglottal area. So as it goes back on the tongue or as it goes down the neck, they have different involvement in different formation of structures. As I said before, the branchial grooves, sometimes referred to as pharyngeal grooves, exist between the branchial arches. So I've got a groove that's between the arches. The first branchial groove contributes to the eardrum, so the tympanic membrane in the eardrum. The pharyngeal pouches develop from endodermal invaginations from the lateral walls of the primitive pharynx. The pouches are kind of like balloons behind the arches, and if I put my hand in through the grooves, then I'd be able to feel into those little pouches behind the between the arches behind the groove. And I said the first pouch contributes to the auditory tubes, the second palatine tonsils, the third and fourth parathyroid and thyroid, as well as part of the thymus, which has ectodermal origin. Here's a picture showing the developing embryo, and it shows the lens placode up here towards the far left, and then the otic placode kind of up at the top there, and then the branchial arches 1, 2, 3, and then 4 through 6, with the 5th sometimes missing. Then we've got the grooves that lead to the pouches, so like the little balloon-like structures as you pass from the groove on the outside towards the pouches on the inside. The first branchial arch is the mandibular arch, the second is the hyoid, the third is parts of the hyoid bone and pharyngeal muscle. 4 through 6 fuse and participate in forming laryngeal cartilage, the mesoderm of these arches, and the pharynx and larynx muscles. This table describes the pouches and what is within the pouches. I also wanted to mention, this is the last slide, but I wanted to mention that we talked about Meckel and Reichart cartilage in class. Meckel cartilage is within the first branchial arch, the Mann processes, and then the maxillary bulges and the mid-ear bones. The Reichart cartilage is in the hyoid bone, hyoid ligaments, middle ear, and process of the temporal bone. Both of those cartilages will disappear during development as the bones ossify. So that's the only thing that hasn't been spoken about that I wrote on the board during class. Here's the pouches describing that the first pouch is the auditory tubes and the tympanic membrane, second pouch, the palatine tonsils, third, the parathyroid and thymus glands, and also the parathyroid, thyroid, and thymus glands.